Well, hello there. It has been 5 years since we last talked. I've gotten married, I graduated nursing school, I have a bachelor's degree, I bought a house with my husband, we got a cat. I was diagnosed with idiopathic condylar resorption about 8 years ago, and what that means is my jaw joint was disintegrating, but the doctors don't really know why. And it was causing a lot of issues with my breathing, with pain and chewing, everything you can imagine. This is my kitty. This is Tembo. Say hi. So I had surgery to fix my bite and allow me to have daily activities and not cause me so much pain, basically. My pain was so bad before surgery that I couldn't exercise, I struggled to sleep, I struggled to chew food and eat, and I was having anxiety attacks because I couldn't breathe very well. My airway was really closed off because my bottom jaw had moved backwards. Now, I'm fully recovered from that surgery. Day to day, I don't have pain, which is incredible because I definitely used to. I know last time I also gave an update, I think it was at the 1.5 year mark post-op, and I still had numbness in my chin because they worked in this area too. And I don't remember exactly when that went away, but sometime in the last 5 years that went away, and I don't have any numbness. I have full feeling everywhere in my chin and in my lip. My teeth have moved, and it's nowhere near what it used to be. Like I said, I don't have the pain anymore. I don't have like the airway issues anymore, but I can tell things have changed in my jaw even still. I'm gonna show you my profile. You can see my jaw right here looks very different from how it used to look. And it used to be like pretty much a straight line, but in the last handful of years, this section looks like it's disintegrated, melted away. It looks so weird. And I don't feel like, it feels like bone. It doesn't feel like sore. It doesn't feel, I don't exactly know why that happened, and I haven't been to an orthodontist to really check in on it. I need to, but I've just had some other health things come up that I've taken priority. I'm definitely a little concerned, and I think that I'm on the fast track to needing joint replacement, which sucks, but I think that's going to be in my future after all. I was really hoping that my last jaw surgery would eliminate the need for that, because my surgeon worked on the top jaw and the bottom jaw, and he thought that 9 months post-op he could tell that it was stable enough that I wouldn't need that, but there has got to be something else going on that I just haven't, and we just don't know what it is. I've done a lot of research, and I've looked into genetic testing, I've looked into symptoms in my family, and I think, not 100%, but I think that my family might have a connective tissue disorder called Ehlers-Danlos syndrome that might be the cause of my jaw issues. But if it's not that, I've also begun learning about mast cell disorders. In the last year, I've been diagnosed with a type of mast cell condition that I think also might play a role in my jaw. And I'll get into that diagnosis in the future video because there's a lot to say there. But I'm toying around with the idea of if I have mast cell activation syndrome, or if it's a subtype of something related to mast cells. Mast cells, if you don't know, are a type of immune cell, and they can just do really funky things with the body. I've noticed many patterns related to histamine foods. I've noticed that if I eat high histamine foods, I feel like garbage. And that's been really, really apparent as I've been recovering from this summer of surgeries. Maybe it's been there all along and I just didn't know what it was. And maybe just surgeries in general, my body just doesn't tolerate very well. But there's definitely something going on there with antibiotics, gut issues, food intolerances. Yeah, that's my story. I am glad that I had the last jaw surgery because I feel like it gave me a few more years to kind of feel like a normal person, and I wasn't quite ready to do joint replacement. I'm not ready to do joint replacement even still right now. That's not anywhere on my radar at the moment as far as like scheduling that, because I don't have the daily pain that I had before the last surgery, and it's just not as serious. Like, really my main concern is just, I'm a little self-conscious about my jaw still. I'm self-conscious about my profile. I'm self-conscious about my bite. I didn't even show you my bite. I'm sorry if there's food in my teeth. You can kind of see there is still a bit of an overbite, a bit of a gap between the top and bottom. There's a little bit of a gap, probably more than there should be. It's not to the point where I want to go have joint replacement, because that is going to be the worst. I don't want to do that. So I'll give it a few more years. If I start to have the pain that I used to have, if I notice that it's moved back more and it's closing off my airway and I'm concerned about that, yeah, I'll schedule it. But we're just gonna push that off. If you followed along this whole time, thanks for being here. I hope that in the coming months, as I post things on this channel, that you'll still enjoy it, and maybe we'll go through joint replacement together at some point. Hope you're having a great day. Bye.